Thank you, and welcome everyone to today's webinar. Thank you again for joining us. Good afternoon or good morning, depending on where you are. My name is Maria Noesi, and I am your host today. We're excited to have all of you join us for a webinar presentation, our encore on school mental health and COVID-19 and connecting with families at home. Thank you for joining us. I am joined by a panel of experts who will share insights on what they're experiencing and what they're hearing in their service area that you can take away and apply in your own community. So before I hand it over to them, I'd like to get started with some housekeeping. So today's webinar presentation is being recorded, so don't worry about taking any notes. We'll make sure to send you a copy of the recording as well as the slides right after the webinar presentation so that you have that and can share that with folks. The next thing is that you are in listen-only mode, so we won't be able to hear you during the presentation. However, there is an interface on the right-hand side of your screen that you can use throughout the presentation to submit questions. We will be monitoring those, and at the end, we have reserved time to answer those, or as many as we can, okay? And finally, for those of you that are on social media, please connect with us on Twitter, Cognito, or use the hashtag Cognito webinars, and we will also keep an eye out on those throughout the session. As we begin, I do want to share a couple of poll questions. So I want to invite everybody to come back to your screen and just participate in the poll. So the first question is, what's the current status of your district's COVID-19 student support services? So you'll see that on your screen. Please respond. The options are in place and fully functional. It's a work in progress, still in the planning phase, or you're not sure. So again, the question is, what's the current status of your district's COVID-19 student support services? All right, and I see a lot of you are responding, so I'm going to give you about another second or so before I close the poll and share the results. So it looks like the majority of you are in a work in progress stage, which is not surprising. Only 34% feel that it's in place or fully functional. And what's great is that only 3% of you are still in the planning phase, and only 7% are not sure. So again, I hope this session helps sort of solidify your plans and adds more value as you continue to work on your resources and services. So let's move on to the next poll question, which is more about what is the biggest priority or concern when it comes to supporting your students' mental wellness? Is it access via telehealth? Is it engagement? Is it a capacity and resource constraints, or is it others? And if it's others, please use the question box and share some comments. What is that other category? Or what are some additional concerns that or priority that is currently on your plate that you can share with the rest of the group? So I'm going to give you another second or so to respond. And here we go. Share the results. So it looks like 62% is mostly concerned about engagement. 20% in capacity and resources, 16% on access via telehealth, and only 3% other. So again, for those of you that fall in the other category, please share with us. And again, a lot of the content that is being shared by our panelists today will cover some of these things. So again, we hope that you find it valuable. So with that, I'm going to hand it over to Jennifer Spiegler, who will be moderating the discussion this afternoon. So Jennifer, take it away.
Okay, thank you, Maria, and thanks, Maria and Scott, our team who are running our back end today. And thanks everybody on the line. I see there are many of you from all over the country, so thanks for taking time to be with us today. I'm Jennifer Spiegler. I am the Senior Vice President of Strategic Partnerships at Cognito. That's me to the far right of your screen, where I have had the honor and pleasure of leading our work in K-12 for the past 10 years. I came to Cognito with a background in instructional design and strategic communications and desire to bring effective technology to scale. And I'm happy to say I feel like I've done that. We've trained about 800,000 educators since we started doing that work. So one of the great pleasures and honors of the work that I do is that it brings me in contact with and conversation with some of the smartest and most dedicated people in the country doing this work of supporting students and families. And today, I am honored to bring you the voices from across the country and insights from some of the most visionary Cognito partners. Three of these folks are with us on today's panel. Jennifer Del Bono on the right-hand side of your screen, and she'll wave to you. Jennifer has been an educator in California for 23 years. She currently serves as the director of Safe and Healthy Schools in the Santa Clara County Office of Education. She's dedicated to promoting equity through health and creating possibility for all. Along with Cognito, the Santa Clara County Office of Behavioral Health, and the Herd Alliance, Jennifer's office at the Santa Clara County Office of Ed is also the hub for a public-private partnership for suicide prevention in Santa Clara County, working with about a dozen school districts, and we will hear from her shortly. Next, Stephen Shields is the Director of Behavioral Health and Wellness for Fort Bend Independent School District near Houston, Texas, where he served for the past 6 years. Prior to Fort Bend ISD, Stephen was the Director of College and Career Counseling at Pflugerville ISD, where he was also the lead counselor for Hendrickson High School before moving to the district level. He's been a school counselor at all levels in Chicago Public Schools and Austin ISD, and he began his career, his counseling career as a licensed professional counselor, where he served children and adolescents in both inpatient hospital and community settings. His passion is mental wellness and removing the barriers to high quality services for the underserved. Incidentally, Fort Bend ISD is a member of the Mental Health America of Greater Houston School Behavioral Health Collaborative, and he has been using Cognito simulations on mental health and trauma as part of the Hurricane Harvey Recovery Project funded by UNICEF USA. And next on your screen and last on our panel is Olga Acosta-Price. Olga is a clinical psychologist with postdoctoral training in school mental health. She's the director of the Center for Health and Healthcare in Schools, a national resource and technical assistance center based at the George Washington University Milken Institute School of Public Health, and is an associate professor in the Department of Prevention and Community Health at the university. Olga has been a subject matter expert on a number of Cognito simulations and is a co-author on research looking at the effectiveness of Cognito simulations. Next slide, please. And thank you, all of our panelists, for joining us today. One word about Cognito for those of you on the line who don't already know us. We are a health simulation company that believes in the power of conversation to change lives. In K-12, our simulations lost my place. In K-12, our simulations empower hundreds of thousands of educators and students to take effective action that supports school climate, safety, and well-being. Our growing portfolio of programs addresses mental health, trauma, suicide, and bullying prevention. And it features practice conversations that help build skills and self-confidence that lead to more frequent and effective conversations in real life. Our evidence-based simulations can be delivered alone or as part of a blended learning workshop and can be conducted either in person or fully online. If you're looking for remote PD or curriculum in any of these crucial areas, I encourage you to sign up for a demo at cognito.com. Okay, let's get started. So, whoops, sorry, we're working from home. We got to let the dog out. Go. She has terrible timing. Okay. So if each of you would please give us a little context about the setting in which you work before we get started with questions. And if you don't mind, each one of you has a kind of mental health starting point for the work that you're doing in your districts or your area. So please give our audience a little bit of a sense of that. And Olga, we will start with you.
Great. Well, thank you so much for having me. It's wonderful to be with you all. As was noted, I am a university partner, really, that has worked collaboratively with the school districts in Washington, D.C. Although we are not large in geographic area, we actually have numerous LEAs within DC. So for those of you who may not be familiar, we have roughly about 238 public schools in Washington, D.C. About half of them belong to or a part of D.C. Public Schools as the LEA. The other half are public charter schools, some which belong to a network of charter schools and have multiple campuses, and others who are themselves just single campuses, all of which are their own LEAs. So it's an interesting context in DC to do this work again when we're thinking about how to institutionalize and make systemic change when we have really education systems that operate quite distinctly from each other. We have a fairly large enrollment of students and educators. And I think the event, we have, DC has invested in supporting a comprehensive school behavioral health system since 2000, when it got its first Safe Schools, Healthy Students grant from the federal government as a way to sort of begin and launch that work. But it really was probably a tragic shooting that involved young people roughly in around 2010. With young people who were really pretty disengaged from school, and a sort of an altercation that occurred that resulted in multiple deaths that led to our Capitol Street Memorial Act of 2012, passed in 2012, within which one of the provisions was that really legislators and policymakers wanted to see that every single public school in the district would have a fully functioning, robust, multi-tiered system of behavioral supports for all students, and to really make sure that the city offered the kinds of resources necessary to bring that to fruition. So it was really, I think, that piece of legislation that kind of catalyzed a lot of where we are right now, which is to say, in the last couple of years, the mayor has taken this on as a citywide initiative. And every district agency, essentially, that we are under a full initiative to do comprehensive school behavioral health in every public school over the next 4 to 5 years.
Thank you, Olga. Next up, I can't remember whose slide is next. I think it's Stephen's. Scott, can you? Okay. Nope,
Yeah,
I'm wrong. It's Jennifer. Nope, sorry, it's Jennifer.
Okay, it's okay. Do you want to go back to?
No, go ahead. Scott.
Okay. Yeah, so I'm the director of behavioral health and wellness for Fort Bend ISD. It is a district just south of Houston. It's a suburban district, but it also part of our campuses, or some of our campuses, are in Houston. So we're considered one of the, if not the most diverse district in Texas, one of the most diverse, and that's both socioeconomically as well as our student groups. And so we have extremely wealthy areas and campuses, and then we have 3 of our 11 feeder patterns that are Title I. So we have a wide variety of campuses and students that we serve. One of the things, obviously, that had a huge impact on our district was Hurricane Harvey. And so one of the ways that the Board of Education and the superintendent, Dr. Dupree, just prioritized mental health and behavioral health is creating a new division. And so we created a division called social emotional health and comprehensive, social emotional learning and comprehensive health. And that division united school counselors, nurses, social workers, mental health counselors, just a lot of the professionals that were operating separately and in all different divisions throughout the district. And so my department, which is behavioral health and wellness, is within that division. And I oversee the social workers, the mental health counselors, the nurses, PE and health, as well as PBIS. And so we really have pretty much all 3 of the tiers represented. But we have all those professionals in one department. We have active, we try to do weekly PLCs with those professionals with common campuses that they serve to talk about the students that they're serving in Tier 2 and Tier 3 and how they can partner with the campuses to improve systems. And so I think that as we've created our multi-tier system of support infrastructure this year, has kind of been the start of it. It's really been put to the test as we have transitioned it to a virtual setting. And I can pass it to Jennifer.
And pass it to Jennifer. Thank you.
So our county is quite large. There are 32 districts in our county. You can see 423 schools, approximately 272,000 public school students. And if we add the private school students, we're up to about 400,000 students in our county, and over 11,000 plus educators and paraprofessionals, right, in our county. My background is, I was a continuation high school principal, special education teacher, and a new teacher coach. And so mental health was always something that was very critical as a prevention element, not only an intervention component of our schools and supports, but I was very much aware in my own personal experience of the need for preventative mental health, right, as an educator and a parent. So assuming my position at the Santa Clara County Office of Education approximately 18 months ago, we hosted a huge symposium, and the symposium was telling the truth about our systems and creating a compassion-informed response. And we were really leading with that compassion piece and the prevention and mental health. Little did we know that we would then have a shooting, the Garlic Festival shooting, that would occur in the southernmost city in our county, is where I live, in Gilroy. That event impacted our entire region because of the nature of the event, but also the volumes of people that volunteer and attend that annual event. That really solidified for me the need to really promote prevention, mental health supports, now in an intervention mode. Cognito has been a great partner with that. In our division at the County Office of Education, we are the Regional Technical Assistance Center for PBIS. We're also, we have the Tobacco Use and Prevention Education Department, the Suicide Prevention, and also the Foster Youth and Homeless Youth team. So we were able to align each of these teams and efforts to really focus in on root causes and prevention, really making the Cognito work and mental health focus a priority for everyone. And again, after the Garlic Festival shooting, I can tell you from my own experience, the impact on adults was as great as the impact on youth. And as adults who serve youth, we're so used to and accustomed to serving kids, right? And focusing on their needs. And this was really, I feel like, the first time it forced adults to have to consider our own mental health needs as well as the needs of the youth. And so, and now here we are with COVID-19, and that's really playing out and providing more evidence that that's where we need to be.
Thank you. And, you know, I think we want to start off, so you each have a really extraordinary role within your area, and then each of your areas is sort of an, you know, really extraordinary way that you are approaching MTSS and this crisis, coming out of the things that you've already put in place and already learned. And I'm noting that in our in the question box, there's a lot of questions that have come up in the early conversations I had with each of you around engagement and how we deal with students who aren't showing up, and how we deal with crisis response. So I'm sure as you're talking, you will touch on each of those. And we're going to turn to Stephen first to talk about specifically about what we're learning about the MTSS framework as a flexible framework for this new virtual school environment and supporting our students and families. And when we spoke the other day, Stephen, you talked a lot about goal number one in your response to this COVID situation really being about engagement. So if you wouldn't mind starting there, that would be awesome.
Yeah, so one of the things that I think that I'm probably the most proud of as far as Fort Bend ISD, and this has been a whole district effort, is the engagement piece. So we made a very early decision that all of this was going to be based on equity and access. If we were going to shift our entire schooling to an online environment, we had to make sure that our students had the technology that's learning as well as receiving support. And so just as some examples, the very first week when we launched online learning, there was no content. And so if we think about the tiers, like basically our teachers on tier 1 were just engaging with the students. They were seeing who was logging on, they were seeing who was participating, and then they were following up with the students that were not participating, trying to understand, is it a technology issue? Is it a space issue? Like, what is going on? And so just to, because I know we don't have a ton of time, but one of the things that we realized early on, and we suspected this, is that students just didn't have the technology to do the things that we're asking them to do. And so we have delivered 4,000 laptops to families. We have the bus drivers, we use the bus routes to basically go outside of their homes. We had a plan, they knew we were coming. They came out, they took the laptop, and so this has served over 7,000 students that previously were not engaged. And so that work hasn't stopped. So the first week we did engagement, and now we're kind of on tier 2 now, where the school counselors are calling the students and families that the teachers just cannot get a hold of. And so that's kind of right now where we're at. And then we're in my department, we just had a meeting today with the assistant superintendent that's over the engagement plan, just how we're going to step in, once this gets exhausted, to see how we can creatively provide support to make sure that, because right now out of 80,000 students, we have 3,000 students that have not engaged at all, that we're just kind of missing. And so that's going to now become the focus to get those students engaged. And just one other thing, I'm sure that your districts are doing this as well, but a big part of our MTSS is really what we try to do is basically shift it from the building format to the virtual format and not do a lot of changes. Our professionals were used to it, our families are used to it, going through the school counselor, having the school counselor being on the ground, being kind of the initial contact point. And then if it was beyond their scope, they would make the same referral. We have an online referral form that comes to my office for social workers, mental health counselors. For our external partners, we have Vita Clinic and Clear Hope that they also provide services. They all quickly switched to virtual, which I can talk about that later, that process. But so that's really, as far as the engagement piece, like we are still, even though may go back to school May 4th, which I doubt, we are still actively calling and trying to engage students and trying to think of other creative ways, calling a friend that a student knows, just whatever we can do to make a contact.
I want to go to Jennifer. Do you want to add to that? We were talking the other day about the equity issues that arise from having kids in their homes. Or to follow up on my brick and mortar MTS and now virtual MTSS.
Right. I think the very similar to what Stephen was talking about. It's just the goal right now is trying to engage with families where they are. And the biggest area that we found is that, with schools, we want to go directly into providing education. And what we had to realize very quickly is that we had to really address the basic needs of families first, along with deploying the devices, right, so that they could log on, but really meeting basic needs of families and addressing Maslow before Bloom, right? And that engagement piece has also been supported by partners in our community to address those basic needs. And some of our community-based organizations have been great cultural brokers engaging those who may not have even been engaged during the regular school year, right, when we were face to face, using some of our cultural brokers through our community-based organizations to do the outreach that might have better outcomes than when the school is calling, and can have conversations that are possibly even different than the ones that we have. And so I think really what we're learning is that the basic needs had to be met first, and really addressing the family needs before we could really get into the access and equity with the educational piece.
I want to follow up with you with a quick question that's coming across from our audience that ties in, which is, she writes, I'm finding my phone calls home to connect with and support the student are turning into counseling sessions with stressed parents, and I never speak with the student. While I see the value in talking with the caregiver, I'm curious how to navigate and get to the student themselves. Do you have a response to that? Anybody?
Well, I mean, just really quickly.
Go ahead, Stephen. Yeah.
No, so first of all, we've also experienced, like, some of our, this past week, some of our higher level mental health referrals were actually parents. And so I think that just an understanding that this is really, really, really a stressful time for them. And I think having the mentality that you really are supporting the student by supporting the adult, or by supporting the parent. And then you could obviously once that's completed, and maybe have referred them to resources, or just have validated and acknowledged their frustration, their just feeling like incompetent with trying to balance the teaching and the parenting. And so, like, sometimes they just need that validated. But you could, I mean, obviously you could say, hey, this has been, really glad that we had this opportunity to talk. I really would like to also just have a touch point with your son. I want to see how he's doing. I haven't seen him for a while. I've really enjoyed being his counselor. I would love to just kind of just do a quick check-in.
Can I follow up on that?
Please.
So that does lead into what our mental health professionals are sharing, the same stories, Stephen, that they can't really ensure that the room is quiet enough or secure enough to do cognitive behavioral therapy or motivational interviewing. So what they're really doing is focusing on skills, not conversations. And the skills are really, what they're finding is that they're focusing on families and adult behavior. That's even what the mental health professionals are sharing with us, and that they're understanding that they're addressing these root causes and they're meeting families where they are. Parents are on edge. The mental health support for families really are critical in order to support the youth, because adults create conditions for youth, right? To be successful in the classroom or successful at home. And home life is challenging right now. The mental health professionals are sharing with us that parents are saying, these kids, I don't know what to do with them at home. And they're really going back to basics with family systems and structures. So the educator, I like how you reframed, and let's go ahead and check in with the youth now. Mental health professionals are doing the same thing, and they're even finding that they're getting the parent and the child on the call together and working on basic family structures together and skills, mental health skills, not conversations. And I'm finding that we were probably always needing to be here, right? Supporting families with supporting their youth and supporting adults to support youth. It's a new area for us. But I like the idea that if families can at least start engaging in those relationships and community buildings with families, we can ultimately leverage those relationships, I'm hoping, later.
Great. Olga, I want to bring you in here.
Yeah, you're going to ask me a question. I'd love to comment.
Respond.
Okay.
Yeah, please.
Yeah, no, I absolutely agree with what Stephen and Jennifer have shared. First, I'll start with just talking about engagement for a moment. Similarly, our educators and school administrators and city leaders have very much prioritized family needs, sort of, stable housing. How are we ensuring access to free meals? How are we making sure that we know who isn't mobile and can't go to access on some of those services who don't have internet, who don't have electricity? How do we share what resources and free resources are available? So that very much was a priority. And then really quickly transitioning to how do we, and then getting the technology, the hard technology to families, which very much DC invested quite a bit in making sure that families had that hardware and computers and iPads and Chromebooks. But then it transitioned quickly to how do we engage those families. Similarly, probably a similar proportion as in your districts, we have not been able to connect with some families, and the worry about how they're doing and how to support them. And so similar strategies to what Stephen's mentioned, looking back at emergency contacts and documents that schools collect, and using all of those contacts, calling friends and classmates to see if they've happened to see them, and can get a word to them. But also thinking about who are some of those neighborhood leaders. And so we're exploring things like, what are the parent groups, that sort of very, very community-based parent groups that do have these relationships with families and can often know those like struggles that they're having that maybe explain some of the disconnection and why they're not responding. As well as in DC, we have sort of ward level or kind of neighborhood level leaders, like ANC leaders. And again, often they are the ones who have some sense of like what's going on in various parts of the neighborhood and can be some of that connection into the neighborhood. And so exploring how we can utilize them to reach out. I'll say that one thing that we're doing as it relates to kind of collaboration is we're looking at efforts to where a school might in the past been able to ask for a well check from our child welfare agency when a student would go missing really for weeks on end. But given restrictions and being able to do a lot of that, and just how overwhelmed every agency is in this period, we really tried to coordinate efforts between the LEAs and our child welfare agency to really kind of prioritize those families where we've tried, everything has been tried, and coming up with a protocol, kind of a well-checked protocol to be utilized with the child welfare agency, and kind of coordinating and identifying those most at-risk families as sort of, again, one of those sort of last-ditch efforts to really just identify how they're doing and how the students are doing. So I just wanted to mention some of those strategies, nothing new, but just to underscore the importance of that. I love what Jennifer said around focusing on skills and on the parent. I say to the person who wrote, good for you that your clinicians are, working with families. We similarly, for those of us who've worked in school mental health a long time, one of the challenges you might hear over and over and over again, school by school, is, oh, how hard it is to engage families in some of this work sometimes because you're doing it school-based. Well, now we have an incredible opportunity. We're literally going into the homes to do telehealth, telepsychology, telepsychiatry, and really have to work through the families to get access to the kids. And I think that's an incredible opportunity to have them feel engaged and partnered in the delivery of those supports, at the same time that we can say we care about you, your family's well-being is what's going to, is what's important for your own child's well-being. And I think that it's an incredible opportunity to, and I hope it's something that we continue to then leverage and you do after this crisis is over, is that we figure out how to maintain those kind of active collaborations that we've been building with families.
Right, because you always hear that, family engagement is sort of the holy grail, and now we have it, right? The families are right there. I have two definitional questions for you from the audience. Can you define, Jennifer, what the term you're using, cultural broker, for the audience?
A cultural broker, in the way that we define it in our county, is really someone who is in touch with the needs of the community in which they serve. So this might be if you have a youth center that's centrally located and has a number of at-risk youth who live and recreate in that area. These might be the community-based organization workers who provide the after-school programs or the culturally based programs that students have been referred to. We're leveraging those partners with different relationships with families and students to engage.
Great. And another question, definition question, I'm going to give it to Olga. Can you define MTSS for our audience?
Sorry, MTSS literally stands for multi-tiered system of supports, and it may take shape differently in various districts and communities, but essentially it is the idea that we are promoting the delivery of and organizing and coordinating the delivery of interventions based on some known and assessed need. Typically that's the subject of that is commonly a student. So thinking about the needs in tier 1 being what is available as a whole school or an entire community, what interventions are offered to support, in this case, mental health and well-being for the entire school population. Tier 2, referring to those more kind of selective sort of interventions that where there are emerging problems and what you offer to everyone isn't sufficient to address the needs of an individual. And so therefore they're more targeted supports that can be made available often in group formats and individual formats to support their development. And then tier 3 refers to kind of more individualized or specialized support or treatment that's available because tier 1 and tier 2 supports just again are not sufficient, or sometimes you know from an early assessment that you just don't, you need directly to go right to tier 3, which again are more for individuals who have maybe more severe or challenging kinds of behaviors or emotional presentations or symptoms. So that's I guess how I would define it.
And who mentioned this? Using other students. I think that was, who mentioned using other students to find other students? The question is, if you ask students about other students, does this violate HIPAA or privacy?
It's a good question. So I think if you just have the student like reach out to the student to see if they to give them my number or like for them to contact, I think that's fine. Like especially like as a counselor, hey, I know I'm really concerned about Juan, and I know that you're friends with him. So I was wondering if the next time you see him or if you guys talk or text, if you could just let him know, hey, here's my number, have him give me a call. I'm just worried about him. And so I think that you're kind of already leveraging a knowledge that you know about this relationship, but I'd welcome someone else to jump in on that one.
Yeah, no, I would add, I agree, and I would add that especially if we couch it in terms of, our school goal is to connect with every single student in the school, and and so we're making extra effort to try to find Johnny because Juan, we haven't heard from him and his family. So it's not that, he maybe has a pre-existing relationship with me or has gotten counseling. It's just we're sharing the role across the staff to try to identify every single student and not leave anyone. And so I think that's one way to circumvent maybe, or to kind of make sure we're not disclosing anything. The other way that we're trying to do it also is within the context of a classroom. So maybe when a teacher or someone who has started to engage an entire classroom and there's 2 or 3, a kid who maybe isn't, is to say to the class, because they'll know, well, Juan isn't, we're missing Juan and we're missing Sally. So is anybody, in contact with their families? Do you live in the same, projects, or do you live in the same neighborhood? If so, could you let them know we really miss them and that they could get in touch with me, their teacher, or whatever. So we're trying to think about kind of the natural opportunities to do that.
So this is kind of going along this lines of engagement. There's a lot of questions here about, marginalized populations, homeless youth, English language learners who might live in communities that tend to shy away from mental health anyway. Any kind of strategies that you can share specific to those. I mean, homeless youth must be just very, very difficult in this moment, as in, even more difficult. Okay, there's no solution there.
Well, I think the solution is for many of our youth, they already had referrals in place prior to COVID-19 shelter in place. And so it was really about ensuring that those existing referrals were continuing. And then we have liaisons. So there are point people who are paid, right, to focus on these marginalized youth and really deploying those teams to wrap around and ensure that youth are getting what they need at this point in time. And I think we had talked about just being really flexible with the idea of team, reorganizing some of the teams to really be targeted and wrapping around, ensuring that these marginalized youth are being served. And then some of the other things that we're doing now is we're really trying to communicate to our partners, our behavioral health partners, of our Office of LGBTQ Affairs, Public Health, our Department of Family and Children's Services, and really relaying to them what the need is. And they're coming back with some strategies and ideas that we're now trying to keep that communication flow going so that it's a two-way street. And so DFCS is creating a protocol right now to support teachers with online assessment of when a child might need more assistance and what that mandated reporting might look like, because those numbers are way down. I mean, significantly down. So how do we support teachers and those who are engaging with marginalized youth to make the call? What does that look like? And then we also have our behavioral health team, suicide prevention team in particular, who's working now on virtual town halls, basically a webinar like this with specific communities. So there was just a recent town hall with the Nepalese community, and it was way more successful than they anticipated it to be. And now we're thinking, what if we did a youth town hall with some experts and some panel members, maybe even some youth in our community, to support other youth in engaging in dialogue about what they're experiencing, providing a little psychological first aid, right, for everyone. What's occurring to you right now? How can we help? And then also just thinking of creating that possibly for the LGBTQ community and maybe even for families. So those are the ideas that are really occurring right now, and we're creating it as we go, as the need presents itself. So, but it's that communication about the need, right? How do we know there's a need? How are we asking the right questions to find out from families what the needs are? And then when we assess that need, how are we sharing that then with our partners to help respond to the need?
Great. Stephen, I have a question that I want to direct to you from our audience here, which is about crisis response. And I know that, and how do we do, now I've lost the question, suicide prevention and how do we do, what is your process for connecting with students that have had suicide risk assessment? Stephen, can you take that, please?
Yeah, so a couple of things. One is, so just as far as, and we, created a virtual plan just so principals and counselors had it, but we really tried to mirror our current plan, which is that our counselors are on the front line doing assessments. So if we just had a situation yesterday where a teacher brought it to the counselor that there's a student that expressed some suicide ideation in their office hours. And so the counselor got in touch and was able to talk to the student. The counselor felt like a wellness check was in order. And so had our Fort Bend ISD police do a wellness check. They're mental health trained. And so that was an example where, just that we're pretty much following the same protocol. Like our school counselors are on the front line of these initial suicide evaluations. And so we wanted everybody to know in our community that the same thing applies. Don't feel like just so they know where to go. And so one of the things that we've really tried to do, thinking about our parents, is we pretty much every week try to get something mental health into our Community Express newsletter that goes out from the superintendent. And so, we, just to make sure that they know that there's a lot of virtual services available, like where to go, we provide a link with all school counselors' contact information. So it's in one click. We create a video. What we're really trying to do is get parents to our site, which has like a ton of resources. And we've had, 70,000 visitors just in like March and April. So just to communicate like what that is and to make sure that they know. We also have a hotline, a text line. I've been getting, we get our daily report from our suicide prevention line and so we get a report of those students. I refer those students to their counselor if the student identified themselves, and the counselor follows up to make sure that they're okay. Those are the ones that aren't an immediate risk. Obviously, the ones that are an immediate risk get taken care of immediately. So it's really like replicating our current systems, but also making sure that everybody knows that that's the system, so there's not confusion and assumptions.
Great. I want to turn to the question of teaming and the virtual team, and we've touched on it a little bit. We've talked about using those cultural brokers. Olga, I want to talk to you a little bit about how does this virtual environment affect teaming for the mental health space?
Yeah, absolutely. It's one of the really critical processes that sort of this teaming and collaboration that we are focused on making sure we transition into kind of a virtual platform. And I'm going to just say a few words maybe about it, both from kind of a system, kind of a cross-sector teaming, and then within school teaming, because obviously there's a role and complementarity between those teams that we are always thinking about. Where we currently are in DC is that we're implementing, as I mentioned, this broad citywide plan that has a lot of cross-sector investment and commitment. And one of the bodies that was created pre-pandemic is what we call the Coordinating Council for School Behavioral Health. And it's a body of both district leaders, community leaders, parent groups, and really these stakeholders that are invested in school behavioral health in DC, who have come together in this coordinating council and have the authority to oversee the implementation of this plan. So this body is very important, and it's a body of like 25 to 30 leaders, which has functioned really well because it's sort of a very focused kind of targeted aim, although very complex. And again, cross-sector education, behavioral health, our child welfare agency, we have different structures in our executive leadership, from the mayor's office, city council, so we have kind of representation. And that body which meets monthly, continues to meet virtually and will continue to meet virtually. And that's really important because it communicates that this is still very much a priority, and it's those entities that are continually coming together to try to think about kind of these system level improvements and changes that are necessary around sharing information, around how we're coordinating, around what data can we share with each other, around what are the regulations that are standing in the way of us being able to actually scale our telehealth. So for example, we have, I think in accordance with the federal Medicaid and others, we had a rule that said that, phone calls could not be reimbursable services. And now telephone calls are reimbursable ways to connect, right? Talking about engagement, because not everyone is going to have another kind of platform, but many people have phones. Again, not 100%, but that allows them, for those who have to think about reimbursement as a way to stay open. And so there's a lot of coordination that's required to make sure that those rules and regulations, which were put in place for a reason, are appropriately sort of adaptive and relaxed as necessary. And then we think about kind of what this coordinating council and this body said, that in addition to the fact that we want, the way we're going to build capacity for schools to actually have the ability to address the full continuum of care in any given school, is that we're going to partner the community-based professionals and mental health providers with community-based providers, sort of this expanded school mental health approach that's been used in many other places and that we've had here since 2000, but really kind of accelerating that. And we now have 11 community mental health agencies, and they are partnered with, with each with an individual school, and place a full-time provider, co-locating services, and then really doing the work to partner these teams in a way to complement and supplement the care that's available across 3 tiers. And having said that, again, we are lucky that work was already underway, sort of as Stephen was saying, like a lot of things were already in place, and it was just a matter of how do we pivot and how do we take advantage of that, but shift in this new set of challenges. And with that regard, again, still fairly new because we're talking about a big system change, is that one of the requirements for doing this is that we also had a technical assistance provider. That's where my center and GW comes into play, in that we have contracted with the city to provide kind of overarching technical assistance to support best practice adoption for school mental health. Well, we were doing a lot of that work face-to-face, monthly community, and we've used a community of practice approach as the approach by which we wanted to really create the capacity within our community to do shared learning, problem solving, sharing of resources, because there's not a shortage of training and knowledge in our regions, right? It's more of the application of that in practice where we stumble and where we have a lot of difficulty. And so we've really successfully used a community of practice as the approach, but we had to pivot literally, as all of us have, on a dime, from these very intensive kind of monthly where we really gained momentum and we had people really focused on our clinicians and our providers as kind of the linchpins right now to delivering that into their individual schools, and then coming back to this community and saying, this is where I'm struggling, this is where we don't have buy-in, this is where we can't engage the families, what strategies are you using, and really kind of problem solving. So we've shifted now, and a lot of this is paying attention to what the community is telling us. So the community told us a couple of things. One is we still need to build a lot of connection, and we need support, and we need it from each other. So we focused very early on more of, okay, what about your wellness? How are you doing? What do you need? Because if you're not well, then none of our TA and none of our support is going to make it to kind of the levels and reach out to the families. And so then they said monthly obviously is not enough. We need weekly connections. We need to have weekly virtual meetings. And we've had meetings with 100, 150 people at a time, centered around topics that they are identifying as most critical. So both, it went from, we need some tips on how we manage all of this, strategies for our own self-care, what are people doing and using, to how do I apply and do telehealth effectively? I have a lot of questions about how to do that from a practice perspective, not the sort of technical legal, because we figured that out as agencies, but how am I doing this in practice with families who are uncomfortable with us being in their home, and all those kind of very natural, normal concerns. And then again, the answers came from the community, meaning we asked other providers and said, well, what did you do? And what are you offering? And how did you manage that? And then our role is and it's like a crowdsourcing of problem solving, right? We pitch the problem, the community tells us what they've used, and it's a way to show and almost vet some of those strategies in our own local community. And then we're constantly thinking about how do we disseminate, how do we communicate to make sure everyone knows what those innovations are, how they might apply them. So there's been a lot of that. It's not that it's gone perfectly. We're constantly learning things that we need to continue to work on. When schools come together, my last word I'll say is when schools come together, you know, they often will think, oh, quickly, let's do our wellness team, you know, and they'll bring their school hired folks together and start their virtual teams. Well, they forget, oh, wait, we had this community partner also, and we have this other community agency. They haven't been invited. They don't know the Zoom link. Let's get them in. And because, again, some of this is very new. And when you pivot, especially when you're in crisis stabilization mode, you know, get very focused and revert back to what's familiar. But for many others, they've been able to very easily bring those community partners. They've been clear about delineating roles and responsibilities. Here's what we're going to do. We're going to have a Google Sheet where we're all going to put information in our Google Sheet about who's reached whom and how they're doing and what we need. Again, not totally private, sensitive information, but as a way to kind of garner all of this and coordinate it all. So those are some of the lessons we've been learning. I think similar to everyone on this call, it's a work in progress. We are literally figuring it out day by day. But the good news is that we've relied on each other as partners and collaborators in a really deep way. And that's where really the success is coming from.
Jennifer, I think you're muted.
You're right. I want to jump off of that. Thank you, Olga, to bring up a question that's being asked from our audience with regard to engaging school staff. So not just the school provider community and the specialists, but tips that anybody on the panel might have for engaging school staff to join this effort and to create roles and processes from scratch. And this is somebody who works across small rural and small city districts, so with fewer resources than you all have at your fingertips. Question clear?
No, is the question about engaging staff in mental health?
Yeah, engaging school staff to create. So it says, let me read you the exact question. All the speakers seem to be from large districts with liaisons, councils, teams, and tiers of support. I supervise therapists working in several small rural and small city districts. Any tips on engaging school staff to create such roles and processes from scratch? So they don't have all of the resources of a Washington, D.C. or necessarily of a Fort Bend ISD. But Jennifer, you have some kind of outlier small school districts and communities.
Right.
So
Gilroy in
I think
particular.
the question is about taking, go ahead.
No, I'm sorry.
So I think the question is, how do you kind of conscript school staff to play a role?
And I guess I'm still struggling with the question, but
Okay.
what I'm finding is, go ahead.
No, you go ahead.
Playing a role. Well, we all play a role. That's the public health model, and we're already, and we can't help but not to be in this, right? So I think the idea that MTSS, the multi-tiered system of support, what is so nice about using a framework like that is that it does allow us to, I'll just jump ahead. What happened where we went wrong? I can tell you where we went wrong. We jumped right into practices. We need to create lessons. We need to create lesson plans for teachers. And it's futile. That's not an effort that's a really good use of our time right now. When you can see that you're setting up a teaming structure that allows everyone to work smarter, not harder, and be part of the solution, like Olga was saying, and have, like Stephen was talking about, understanding the clear delineation of a tier 1, tier 2, tier 3, where you fit in that role, you're more apt to get people enrolled and wanting to be part of that teaming system versus no plan, no idea, just start creating and you don't know why. And you understand that it's futile and it's actually pretty demoralizing. You get burnt out. So I would argue that especially in a small town, I live in a small town, You know, in our teaming structure, I'm also part of the Rotary Club. My Rotary Club, we have a membership of 22 people. You know, we're part of the teaming process right now. We're assembling science kits and getting it to the school district. We're getting hygiene kits organized through our membership and making sure that it gets to the Family Resource Center. So that idea of enrollment really comes when you're very clear about what's expected, showing everybody what role they play, being part of the solution, and understand how the system works to achieve a common goal. That's enrolling. And I think that's why I just think that's where someone should start. Otherwise, you're an individual feeling like you're, you know, holding back the ocean, and that's not enrolling.
And
Great.
if I could add something really quick, I would just add that anything that you'd like your teachers to do or your staff to do with kids to support them, start with doing that with your teachers. So pick some strategies, whether it be some mindfulness, circle, some simple strategies that you model with the teachers every time that you meet with them, that you start with a mindfulness moment, you do a circle check-in, like the strategies that you want to see the teachers use that are huge on tier 1 to support. A lot of students, that's all they need to get through this. They need to have their voices heard. They need some simple strategies to calm their anxiety. And so when those things are being modeled and in place, most of the students are going to respond to that. And then, and I think that could be their role, like just use this time to really love up on them and to model some of the strategies that you want to see them, like take care of them first so they're able to do these strategies with their kids.
That's a
And I'll
great,
just
great
say one
advice.
quick, it's so great. And I would just say that then in terms of using them and their kind of eyes and ears for then who might need more, is what we're trying to start is exactly that, having teachers do these kind of light touch emotional check-ins with their entire classrooms in a kind of systematic way. Here are the questions you can ask. Again, you could do this first with them, you know, showing them how it would look, how it would feel, and then asking the kids, so who can you go to? Who is your social network? If you're feeling worse, if you're having a hard time sleeping, if you're not feeling good about things, more anxious, who can you go to? And sort of understanding their social network. And for those kids who can't name someone, or there's some other issue that does get, where does that teacher go, and how clear is it where that teacher goes? Does every teacher have the counselor's contact information? Or in some cases, we're having the teachers pop into those classrooms and sort of just listen in, co-lead. Even if you only have one counselor, then see how you rotate that individual when the teachers may be doing their classroom. So there is a way to do it without sort of being resource heavy, at the same time using your very important teacher relationships.
Great. And we are a little over time, but we still have like a lot of people on the phone. So I'm sure this is touching a need. Do my panelists have 5 more minutes?
Yes.
Yeah. Okay, great. So I would like to just round up with the question, what did we miss and what do we need most now? And I want to start with Jennifer, because I think you have some really interesting ideas about the opportunity of this moment.
Thank you. I've been hearing this from a lot of my colleagues, and they really want me to emphasize this to everyone, that this is our opportunity. This is it right now, right? To really focus on what matters most to us and how do we operationalize that. So how do we operationalize relationships, community, health, well-being for everyone? The universe has basically forced us to stop. And we were really focused initially with trying to do things like we used to virtually versus trying to do what we need to do right now, right? This is our moment to reset, to really think about equity in a new way, and to also think about it, about how do we really want to come back from this? You know, the idea that how do we use this experience to understand and create a more equitable school experience for all of our students once we come back? And how do we focus on the mental health and support for our parents, our teachers, our school administrators, so that we really can then create conditions that truly support youth? And then I also see that this is a huge opportunity for us to be accessing and seeing this as a teachable moment to teach health education and literacy. This is the perfect teachable moment to engage students and youth in really being the next public health coordinators or health educators, because health is universal. And we have health education standards. We have health education literacy standards. And when I'm thinking from a teacher's perspective, if I'm trying to create my science lessons and then making them virtual, or math and making it virtual, that's a huge cognitive load for our educators. In addition to what they're experiencing, as all of us are at home, it's not just typically working from home. I'm working at home and I've got my cats and my dogs and my daughter and my husband. I've got chickens outside and I've got all kinds of things going on. We can't just keep doing what we used to do. We have an opportunity to be different. And I would love for us to really see this moment as a moment to really focus on health education, equity, and then it's also perfect, like Olga was saying, and Stephen kind of mentioned it too, really supporting families in an era where there's no blame. Who are we going to blame for this? And in the past, I can tell you as an educator, I used to blame, right? Kids should know, parents don't, I did that. And that really meant a lot more about me. I didn't know what to do really at that point. And this is our opportunity to really just help and support everyone where they are around a health framework, around an equity framework, and just lift from here for all of us.
Great.
I had
Thank
to say
you.
that.
That's amazing.
Yeah.
I would just,
I think
just
you're.
one,
Mhm.
I would just add, first of all, I think that was inspiring and it was awesome. One of the things that it's sort of triggered though, and it reminded me of students coming back after Harvey, is really like tapping into their strength and their resiliency and their creativity that they displayed. Yes, they're going to come back with a lot of fears, a lot of anxieties, some trauma, some loss, a lot of loss. But what were some creative ways that they dealt with that, and what were the strengths that they tapped into to really have it be a strength-based, resource-full conversation? Because some of the things we're seeing as far as how students and families are passing this time is amazing, and just to tap into that resiliency.
That's great.
Thank you for
that.
My final point that I would add in response to this, because I absolutely agree with what Jennifer and Stephen said, is, in times of crisis, and this is great, but it's what we do, I think, as professionals and as systems, is we put a lot of information out. I mean, we have loads of COVID-19 resources, and it's come in every which way but loose. And so and that's great, except it's hard to digest all of that and to know what should I pay attention to? How do I use it? Where am I right now in terms of what readiness I have to do things? And it can actually add to the overwhelm as opposed to supporting.
Yes.
And so I think that one of the ways that we're trying to do that in our community of practice is to go back to our community and say, what are the things you actually are putting in place? What is actually helpful to you? Many of the things which are in those big long lists, but they're picking out the things that in practice really are working for them. And so in essence, we're focused on kind of practitioner driven resources as well as the expert driven resources, and saying, this is a way to help our community not feel like we're throwing 1,000 ideas at them. And in that, really our focus is on the adult wellness. We're really focused a lot on that, and knowing that if we do that, that we know that that's going to improve the conditions for our kids. And that means the teachers, the providers, and the family members. And in no way do I think that means that we aren't focusing on the kids. We are. It's just that we're doing so through a focus on the adults.
Jennifer, can I share one resource? I'm finding there's one resource that I'm really enjoying right now, and I'm finding extremely inspirational, and it's from the New York City Leadership Academy. They've created some excellent equity tools that really, I find that I feel like I know intuitively, but they articulate it so well, and great thinking questions that really support people and think about how we want to be when kids come back. And they have a tool right now called Leading an Equity Focused Response Through and Beyond COVID-19. I really recommend it. Again, that's a New York City Leadership Academy. Great thought partners. I've called them and I said, can we just talk? I would love to know what you're thinking and how we might really work together in this. And they've been great.
Great. And we'll include that in the follow-up email for everybody on the call. And Stephen had shared some resources that we'll add to that. Thank you, follow-up email. And if any of you panelists have any other ideas for things you want to share with our audience, I'm sure they will be grateful for that. So in closing, I just want to say thank you.
I'm sorry, Jennifer.
Go ahead.
I'm so sorry. I know we're way over time. I just wanted to make one plug for the fact that, again, back to sort of resources, we have a lot of information, and it's often written to a particular audience, like a professional or a school leader, and they're good. It's good information. We don't have to recreate a lot of that. Sometimes it's just about thinking, who else can I read? Who can I write this with in mind? So we're doing that as it relates to, we have telehealth, like how do you do good, practical telehealth tips, but it's written for the provider and maybe in thinking about the kid. But there's nothing that says, well, what do we tell the parent around what they should expect around a telehealth visit? And so we're taking that information and making a product out of it, like a tip sheet that's written with the parent lens, so that they understand what to expect, what consent means, that the kid may be asked to do a little virtual walk around so that it's part of rapport building. But parents should know and understand and be a part of that. And so I think we have a lot of information. It's just if we can translate it in such a way for all these important stakeholders in our community.
It's a great point.
Thank you. I think that's right. And I think in some of that conversation, parents are the last thought about. And again, this moment in time needs us to really think about everybody and think about families as systems and the system that we're intervening with right now. If you have that tip sheet, Olga, please send it, and Scott will send it out with a slide and anything else you think would be useful. You know, it's a grab bag out there right now. So thank you, everybody, for your time. Thank you to everybody who stayed with us. And thank you to Maria and Scott for running this great conversation. I think that people will have gotten a lot out of it. I certainly did. So have a great afternoon.
Thank you. Be well, everybody.
Thank you.
Take care of yourselves.
Stay safe.
Bye.
Bye-bye.